The following SHSMD podcast is a production of drpodcasting.com.
This is a special podcast produced on site at SHSMD Connections 2019 annual conference in Nashville, as we talked with keynote speakers and session leaders direct from the show floor. And we are here with Daryl Beneker, Director of Consumer Insights at Advocate Aurora Health, dual headquarters in Chicago and Milwaukee. Daryl's session was building and implementing a consumer insights strategy. Daryl, welcome, and can you give us a brief overview of your session?
Yeah, today's session was talking about the building a consumer insights strategy. And the objectives of today's learning was how to build an internal team, and then also how to leverage consumer insights throughout the whole Advocate Aurora Health system, and how to present consumer insights to internal stakeholders.
Okay, so let's start with this end. How can we build an internal consumer insights strategy or team?
It really involves of having the right resources and the right people. For Advocate Aurora, our consumer insights team consists of 5 team members. All of them see the project from beginning to end, but we do have emphasized specialization for each of the team members to make sure we're providing best-in-class research and moving the team forward. We have experts in online community, segmentation, data processing and database management, and also what's unique with Advocate Aurora, we also include a data visualization expert, which pretty much is the person that takes all that data and put the story together in a concise way and meaningful way for not just the market researcher, but also the higher level of medical doctors as well as the C-suite.
Okay. So what audience then do you gather insights from? Who are you talking to?
Oh, yes. First and foremost, we are talking to our patients using the online community where we do touch base with them with a couple surveys a month, but we also want to grow our business. So we do talk to the general population. So blend of our customers of today and hopefully patients of the future that are presently going to our competitors. And then also we also talk to our employees as well to make sure the research that we're providing is aligning with how the Advocate Aurora brand exists today.
Okay, so once we have that information, how do consumer insights impact health systems, let's say beyond the marketing department, such as service lines? You mentioned growth, in fact, business growth, operations and human resources. How does consumer insights impact those?
Yes, with consumer insights, yes, it's not just about the marketing group. It is satisfying all of the areas of the organization. So if it is, we look at diversity and inclusion, really putting a strong emphasis on that, making sure that we're hearing the voice of the consumer there, not just from Hispanic populations or African American populations, but also looking at the millennials, looking at the seniors, seeing what they're saying and seeing if we need to shift our marketing focus to cater to those segments as well.
Right, that makes sense. So how can we get started with this? What's your best advice or top tip for someone that needs to develop a consumer insights team?
It really starts from the top. You really need to get that commitment from your chief marketing officer and all the way up to your CEO and president. With Advocate Aurora, it was pretty simple because we are a consumer-first healthcare system. And it all starts with research. It's the foundation of marketing to making sure that we are connecting the right message with the right people. It's also one of the big things is making sure you have a devoted budget for consumer insights, keeping it separate from other marketing activities, just showing the emphasis that we have on finding out more about the consumer versus, possibly shifting those dollars to advertising or other marketing strategies.
Right. So you would say consumer insights really are vital for, one, patient satisfaction and business growth.
Oh yes, definitely for business growth, because consumer insights is it's not a task, it's more of a strategy. Mm-hmm. Looking at the long term and looking at making sure we're hitting the markets that we need to hit.
Right. That sounds great. Well, Daryl Beneker, Director of Consumer Insights at Advocate Aurora Health. Daryl, thanks for being on with us.
Thanks for having me. Have a great day.
And if you were unable to attend SHSMD Connections 2019, you can access the session recordings by purchasing the virtual conference. Just visit shshmed.org/virtual conference. And please join us at next year's conference, September 13th through the 16th, 2020, at the Hyatt Regency in beautiful Chicago, Illinois. And if you found this podcast helpful, please share it on your social channels. And to access our full podcast library for other topics of interest to you, visit shshmed.org/podcasts. This is the SHSMD Podcast, Rapid Insights for healthcare strategy professionals in planning, business development, marketing, communications, and public relations. I'm Bill Klaproth. As always, thanks for listening.